The psychiatrist Dr. Daniel Morn is working as a research fellow at the Royal College of Psychiatrists, exploring what sustainability could mean in the field of mental health.
So when we think about the reason for sustainability, we think about the fact that climate change is, as stated by the Lancet Commission and the WHO, likely to be the largest threat in the 21st century to human health. So what are we doing as healthcare organisations contributing so much to what is potentially the largest threat to human health? Because the NHS is the single largest contributor of greenhouse gases in the public sector. When we look at the carbon footprint of the NHS, the single largest component of the carbon footprint is that of pharmaceuticals. And the example that I have is that of flupentixol decanoate intramuscular injection for people with perhaps disorders like schizophrenia or bipolar disorder. And we know that the evidence-based dose is far less than the average dose that's being given in the UK. And so looking at following best practice, if we increase the interval and we reduce the dose to the evidence-based guidance, then we could save about 168 kilograms of carbon per year. That simple change to the prescribing practice can lead to a reduction of £250 per patient per year for that simple intervention. But it can also, if we all followed that practice nationally, we could lead to a saving of £300,000 per year.
Your home and bring you to the place, how would that be?
So when I'm sitting with a patient and I'm talking through a potential clinical decision that we're making together, I'm not just talking about the potential benefits that any intervention might bring. I'm really trying to explore patient preference, because we know that that can reduce resource use if you attend to patient preference. And we talk about social prescriptions in this circumstance. A social prescription is when you might not prescribe a drug, you might prescribe a community group or a walking group or a horticultural therapy group.
That's great. Oh, okay.
There's really good evidence to suggest that a dose of nature is good for mental health. It can reduce anxiety and depression. It can actually even reduce psychotic symptoms that one study has found. It's also been proven to reduce aggression in people with dementia. Realising the potential of the resources that we have available to us in nature, in the community, the support structures that exist in the community is really important when thinking about delivering sustainable interventions. If people want to get involved in thinking about sustainability in their day-to-day clinical practice, the first thing that they should do is join the Sustainability Network for Mental Health Professionals, and that can be found on the Centre for Sustainable Healthcare's website. It's called PsychSusNet. PsychSusNet organised a mental health sustainability summit this year, and that was at the Royal College of Psychiatrists, and over 100 people came and we talked about the importance of sustainability for the future of mental health care. I feel positive about the prospects for embedding sustainability into mental health care. A report that I wrote for the Academy of Medical Royal Colleges about reducing waste in the NHS and thinking critically about the environmental and the economic impacts of our care was immediately taken up by the media and was presented in the Parliamentary Health Select Committee a couple of weeks ago, where there's a great deal of interest in how thinking about this from a sustainable paradigm can indeed improve value.